and you have your family here, but every month you get 15 days holidays. Like it's like the dental colleges in North. 15 days you got 15 days. This boy is a very intelligent boy, and he works in the Das Island. His young wife and 2 kids are in Udupi. And does he want to work? No, he doesn't want to work. But he works for the money. It's big money. If you go to Das Island, work for 10 years, you can build a palace in Mangalore. And so much money. So he goes there. Now what has happened? He gets headache by the afternoon. See, the working style is 6:30 you enter the rig. It's a gas rig. And till 2 o'clock you can't come out. But you get a food etc. there. But by 2 o'clock this fellow gets little headache. So he's worried. So he goes to his doctor. Doctor checks his blood pressure. 150 by 90. And he says you are hypertensive. Already on a drug. After taking the drug, he can't get up in the morning and go for work. So he stopped taking the drug. He felt better. Now he did this business for a long time and had so many drugs, so many diseases labeled, and he has come to me yesterday. So I told him, do you want to work? I enjoy my work. I'm a brilliant engineer. I said, did I say you're not a brilliant engineer? I simply asked you one question. Answer that honestly. Naked honesty I want. He said, no sir. The day I leave Udupi, when I'm leaving Udupi, I'm terribly worried because my wife and children are here. My father-in-law is old and he has to look after. Then when I go there, I don't get sleep. My wife and children are here. But I can't come back because I have to be there. Now, if you don't get hypertension, who will? Now, the treatment for that is not a chemical poison to be put into your body because it doesn't do anything. That will damage your system. So, it will go to the root. And what does Ayurveda say? Prasannatma indriya manha swastha ithya. You must be blissful, absolutely happy, and you have no negative feelings and you have all positive feelings. I see Muditaya. In what way can I help Muditaya? Must be the first thought that should come. The first thought most of us get is Muditaya. Look at his registrar sitting in that chair. I am not in that chair. Will me like at that chair? Blood pressure goes up. Not for Muditaya. Simply say, Muditaya is happy. I am happy. Muditaya is there. What he is doing a good job. Fine. Let him be there. Then your blood pressure will come down. That is what Ayurveda calls as health. Remember that? So enthusiasm to work, because Ayurveda says samikshakari, without work you will die. Anybody who doesn't work, so that's why I told Sridhar Shetty, come here every day and give a new idea to Krishna.
Whose blood pressure will go up, sir?
Both blood pressures will come down. Sridhar Shetty's blood pressure will come down. Krishna's blood pressure will come down. Correct. And then, what should be a doctor to make diagnosis of health or disease? Charaka gives a beautiful idea. Charaka says, a doctor cannot be a specialist in one shastra, one area. He has to be a specialist in many areas. And he should understand the wholeness of this universe. Then only he becomes a good doctor. What a beautiful definition. Today what has happened is, you become so reductionist. I saw another patient day before yesterday, or yesterday. What happens is, this fellow has a chest pain. Okay? Today chest pain means people are terribly worried because they think it's a heart attack and you die. 99% of the chest pains are not due to heart. But anyway, he goes to a doctor and says, immediately the first thing they do is angiogram. Actually, scientific proof is there that angiogram has no place in the diagnosis of coronary artery disease. Because what you see, the so-called block, is there in children also. If a child doesn't have a block, that child doesn't live more than 25 years. It dies of a heart attack very young. Now, if you have a block, it's very good because nature produces a lot of collaterals. Now, these blocks are normal, which are called intraluminal blocks, inside the lumen of the vessel, which is a band-aid. If the vessel gets damaged, cholesterol sits there and the band-aid. And it's good for you. And the intraluminal block, it does not produce a heart attack. What produces a heart attack is an inflammatory plaque in the wall, which is called intramural plaque, or what's called the vulnerable plaque. which is very rare, very, very rare. But you do an angiogram and everybody, do you know why? 76% of healthy young people have got 3 vessel blocks. So is this a good business? If 100 people come to you for a checkup and you do an angiogram of 100, 75 bakras you have got for either angioplasty or for bypass. Now another trick way to do is this. Have you seen this angiogram photographs? It's a film, one side film. It takes only one view. Now if you see this vessel, this is a vessel, and supposing there is a block here, let us say the plaque here. Now it becomes 10% plaque when it got here. When it's got like this, it's 100% plaque. You get that? And the heart is not a linear structure like Euclidean mathematics. It heart pumps like that. So this vessel becomes like that. So in one view it is 100%, in one view it is 10%. So you catch the 100% and show it. You are sitting on a volcano, completely gone. You can't even go home because this might burst. And the wife says, no, we have to go home, we have no money. No, I can't go home. You go and come, because if your husband goes home, he may not come back. But the doctor said the truth, because if he goes home and talks to somebody, he may not come back, he'll go and have a second opinion. So I can't get this bakra out. Today, to have a cardiac surgical setup, you require minimum about 60 to 70 crores. You borrow that money, nobody puts his own money. Everybody takes money from the bank. Calculate the interest. You require 4 bakras every day just to pay the interest. Forget about other things. Now this is what is medicine all about. That is why the Ayurveda's definition says you must be a good fellow in all shastras. In the olden days, only wise people were admitted to the medical school in the Ayurveda. Not one who gets that CET rank. Today it's slowly changing. In the Brisbane University, they have found CET rank holders in physics, chemistry and biology, like very good technicians but very bad doctors. So now they take students from arts, music, literature, anything, fine arts, and there they make very good doctors. So there's a move now in America to change their system to that of Brisbane. So in October in Orlando, we are discussing this also, another thing, how to take medical students into the medical college. Because you just can't take anybody and then train him and make him let loose on the gullible public to make life miserable for patients. I always tell my students, doctors cannot survive without patients, but patients can survive without doctors. So before the doctors are left and patients go away from you, you better change. Because if the patient doesn't come to you, what do? If nobody has a dental problem, what can you do? So, though we say we are here to keep health, we are here to keep disease. This is called disease mongering. Do you understand that?
Box and create a dental problem.
Yes. And that's what I told you about New Zealand. Everybody had dental problem. Actually, to tell you very frankly, I used to go to Somayaji and all for some small things. He was a nice man. He had a clinic next to that Milagris church. And, I was happy. Mohandas Naik, quite happy. Today's dentist, you can't go, my God. They'll immediately say, okay, what is that? Root canal. So I was vice chancellor, one day I had toothache. So, as a vice chancellor, you can't be an ordinary, but they immediately take you to the senior most person there and said, sir, it is on the root canal. I didn't know what is the root canal. I thought we were going to the root. So every day, like that for about 3 months, it went on and on and on. They temporarily filled something. Panpema, Satya. He's Satya. So I had a meeting in Goa, so I had gone there in the hotel, I was sleeping at night. I thought a bomb had burst in my mouth. So, what to do? Suddenly, and again, your vice and so many people are there from the university. They said, oh, our dentist, right? They got to be a dentist. They said, sir, this has to be removed, sir. Now I'll remove your filling. I said, okay, do what you like. Anyway, after that, I came back to Manipal. They said, okay, this teeth has to be removed. I said, where did you do it in the first place? So ever since that time, I have stopped going to dental surgeons. Joking. No, I'll tell you something very interesting. Today we know, tenginenne, coconut oil. You just put coconut oil in your mouth, 1 tablespoon of coconut. Don't tell this to your patients because you lose it. You can do that yourself. Just go on gargling the coconut oil. And it should go through your teeth, crevices, etc., etc. And the whole thing will get digested there. Because coconut oil and mother's milk are the only 2 stuff in this world which can be digested in the mouth. Because salivary trypsin can digest, salivary lipase can digest the fat, and that's how the mother's milk and coconut oil having the same fat, monolauric acid, which is the most important base of human immune system. Now coconut oil has come back. 45 years ago when I wrote about coconut oil, people wanted to kill me. Today I am very happy when I go to Seattle to see the headquarters of Costco, half the building is coconut building. Today every house in America they have coconut water. They don't eat cornflakes with the cow's milk, coconut milk. I am so happy. ಕಾಯಲು ಅಲ್ವಲ್ಲ ಅದು ಇದು ಇಡಿಯಪ್ಪಂ I like saving it with coconut milk and some jaggery, and who wants a cornflakes with cow's milk? So this is coming back slowly.
So it is Nukaddi.
Nukadde. ಮನೆಗೆ ಯಾರಾದ್ರು ಬಂದ್ರ ಕಡೆ ಹೋಯ್ಕದೇಳಿ ಅಂದೇನೆ. Coming back to what I was talking to you about is we must build health and not invite diseases. You will be surprised. I have touched wood. I have no problem with my tooth now because I gargle every morning with little coconut oil, and it's so fine. I have not seen a dental surgeon for a long time now. But sometimes I go to see, just to see because my children, they will say, you must get your teeth examined and things like that. Don't worry about that child, it will laugh it. Coming back to the subject of health. You again must define health in such a way that the man doesn't have to go to a doctor for seeing whether he is healthy or not. So, according to Ayurveda, you can find out whether you are healthy or not without ever seeing a doctor or going to a laboratory. Now, if you go to a laboratory, what will happen? I'll tell you. I'll tell you, you know what happens. You go to a checkup, then all the tests are done. TSH is slightly high. Everything is fine. You are fine. TSH is high. Immediately you are given Tylenol. Take this. But today we know TSH can be high or low for even normal people. Your PSA is high. You are told, oh, prostate, there is a cancer. Now at least government of America said nobody's PSA test will be reimbursed by the insurance company because PSA test is fallacious, 100% fallacious. The minute you go in chest pain, you run on that machine, what's called GTT or treadmill. You know, it's so fallacious. The specificity and sensitivity of a treadmill test is less than 50%, which means whether it is positive or negative, it means nothing. It depends on the incidence of disease in the population. It's called Perloff's hyperbole. And if you know the Perloff is a professor of cardiology in Washington University. Perloff's hyperbole means if you are in Japan, if you have got a 100% positive test, it means nothing. If you are in Finland, if you are 50% positive, it means a lot because Finland, 90% of the people are having coronary artery disease. So we simply do these things. Even today, everybody has done the TMT. I don't know why. But TMT machine is there. And in the corporate hospitals, the management has a meeting and says, Mudita, your quota is so much. Looking at it last 3 months, you are not being very economically viable. That means you can go. So everybody is given a quota. So being a doctor in a corporate hospital is also stressful. Your blood pressure will go up because you are all the time looking at the quota.